I want to bring my good friend in, Dr. Joe Congeni from Sports Medicine Center at Akron Children's Hospital with us this morning. Good morning, Joe.
Hey, Ray. How are you?
I'm doing real good. How about yourself?
Good. I'm shaking off the game from Sunday. That's a tough one. But, we're involved with so many things this time of year, and the Zips looked a little better on Saturday, and high school is well on its way now with week 3. So sports is cranking right now.
It is. What do you have for us today?
Well, our crown jewel was tarnished a little bit on Sunday, our quarterback, and I just wanted to point out what it could be. I mean, life from the TV couch versus life on the sidelines, as I do, in high school and college on a lot of Fridays and Saturdays, very, very different on the sidelines. And I did look at the play with our franchise quarterback, Baker Mayfield, a little bit. Of course, held my breath a little bit as he, spoke at the podium about getting an X-ray and everything else in his postgame. When we talk about wrist injuries, there's a couple that are very, very common in sports, and one of the ones that's really common, and the splint that he had on when he walked out of the stadium that night after his interview, I did look at that very closely too, is the kind of injury that quarterbacks get sometimes is an injury to the ligament between the thumb and hand. And of course I don't know, of course I wasn't on the sidelines, but it's such a common sport injury. I had a couple in my clinic just yesterday, so it's very, very common. What happens in football to ball handling athletes like quarterbacks and running backs happens in basketball quite a bit, is people kind of hyperextend the thumb, and it stretches or bruises the ligament between the thumb and the hand. And so this is an injury that sometimes has a bony component. We were thankful that his X-ray was normal, but much of the time it's just a stretched or even torn ligament. And the problem with it when it happens and occurs, if it's bruised or torn, people have difficulty gripping a basketball, gripping a football, and so it's very well known amongst quarterbacks. And one of the things, and not trying to make excuses, but again, looking at things from a possible sideline evaluation of that, is he played pretty well through 3 quarters. I know you're one of my favorite guests on your show is Terry Pluto. He loves PFF, Pro Football Focus. They had him through 3 quarters as very, very highly rated, and then most of his really bad throws were in the 4th quarter. And the real worry is the people have difficulty in my clinic gripping a ball. We tape them if they just stretch it or bruise it, sometimes more, depending on the extent of the injury. And just here's hoping that it's not a bad wrist injury that he has. But one of the things is when this injury called skier's thumb or gamekeeper's thumb, when people stretch that ligament, so common in sports, and have difficulty gripping a ball, I've seen quarterbacks have real problems throwing a ball accurately. He definitely didn't look like himself in the 4th quarter. I don't know the reason why. He was banged around pretty good. He can't get banged around much anymore. But anyway, a very common injury in sport is a thing called skier's thumb, which is a ligament bruise or a ligament stretch, and that may be some of the explanation for Baker Mayfield on Sunday.
Heal pretty quick, Joe?
It depends on the extent. And so what you do is you compress it, that compressive wrap that he had on when he left the stadium. We compress it, you ice it, you do all of that initial stuff. Young people start to heal early on when it's a grade 1. If it's a grade 2, they take a little bit longer to heal. And so people don't know behind the scenes, and hey, what's wrong with my quarterback just not throwing accurately? Sometimes this is an injury that's fairly common. And I think around the time of the safety, gosh, might have been 2 players at once, the left tackle and the quarterback gets hurt. So that is an injury that it can heal, and especially we hope it was more the bruise type of the grade 1, that he would be ready to go on Monday night so we could resume, catch our breath, and resume getting on to our season for our local team.
Yeah, it's scary. And, he got really banged up on Sunday.
He did.
Yeah.
But, one of the things I wanted to mention today is so much of us for Cleveland fandom is, oh my gosh, woe is me, how it seemed to take the wind out of the sails of the Tribe when Jose Ramirez, also a hand injury, by the way, the hook of the hamate. Now here we are with hand injuries derailed us in that one. It does happen around the league and other places. Gosh, the brilliant star Christian Yelich last night with a patellar fracture. So I don't know if you saw that. That's the Kyrie Irving injury. That's a tough one to come back from. Remember, Ray, that's months of time. So, of course, he's done for the year. But when you have a bright star like that, remember that in the case of Kyrie Irving, he had a couple follow-up surgeries after, and it can linger, and it's a tough injury. Now, they were starting to fade anyway, I guess, the Brewers. But, maybe it's not just Cleveland. Maybe it's that sports, when you play it, injuries have a lot to say about who's left standing at the end, and I think that's going to be a big blow to the Brewers, just the way Jose Ramirez was a big blow to our tribe.
All right, Joe. Good stuff this morning. Thank you again, my friend. Always appreciate it.
All right, Ray. Have a great week. Enjoy this beautiful weather in Northeast Ohio.
I will. There you go. Dr. Joe Congeni, Sports Medicine Center, Akron Children's Hospital with us.